Okay, with that, so we have a couple presentations. Again, Secretary Moran sends his regrets that he's not able to join us. He will join us at a future date, I promise, to talk about some of the things that they're working on. But we have a sheriff representing the sheriff. He's not a sheriff. Well, he could be a sheriff. He's probably been there long enough. John Jones, who's the executive director of the Virginia Sheriff's Association, and Wayne Huggins, who is the Virginia State Police head. And so, Mr. Jones, would you like to join us? Come on in, and I believe we do have a PowerPoint presentation that we can queue up for you. Mr. Jones, welcome, and thank you for coming before the committee.
Thank you, Mr. Chairman. I trust everyone can hear me, and if I can get my presentation on the board, I would appreciate it. And while that's happening, I'll just say that I very much appreciate the invitation to come back. I was here back during the summer in the special session, and today, as you requested, I want to focus on some key issues relating to COVID that we're dealing with. And if I can just go to page 1, the next page of the presentation, I'll get right into it. So this profile is simply relating to arrest. I always give you this, and it really is for 2019. We'll have new numbers coming out in the next month or so. And the far column under total just gives you a picture of the sheriffs, the police departments, the state agencies, and the total number of arrests, both part Group A and Group B. This is derived from the Virginia State Police figures, and then we look at it and divide it up among agencies. So the next slide. Mr. Chairman and members of the committee, this is important relating to the jail population. So on the day before Governor Northam issued the state of emergency, the population in our local and regional jails was 28,483. On January the 5th of this year, the population was 25,473. So you can see it's a decrease. And there are some key issues relating to this that I want to briefly discuss with the committee. What's happened is that the local responsible population is significantly reduced, while the state responsible population in the local jails has increased. And during the early days of the pandemic, DOC shut down receiving inmates from local jails, and I understand that it's beginning to open back up, hopefully maybe this week, for one of the facilities. But what that did, it backed up state inmates in local jails. But then on the other end, sure, the courts were on hold for a while. Sheriffs used home electronic incarceration, and they used a lot of other mechanisms working with the courts and the judges to reduce the intake. And they moved people out that they thought could safely be moved out in the community. So what's happened is that the local population's down, the state population's up. And what that means, if you look at that third point, it's costing more for the state to do that, because the per diem for out of compliance inmates is $12, and we have more of those. And the per diem for local responsible inmates is $4, and we have fewer of those. But the cost is offsetting the additional cost that the sheriffs are facing. So I think that's an important point. Costs are up for the state. It's assisting localities and sheriffs dealing with COVID in the local jails because of the shift in the population. Next slide. During the first month or so of the pandemic, you heard a few reports of inmates in local jails, and they were dealt with pretty efficiently. Sheriffs had reports. They got everyone tested. They were separated and quarantined, and in many of the jails, they were able to alleviate those problems. That went on for quite a while, but recently that's not necessarily the case. We've actually had an influx of COVID in jails. In fact, we had one deputy sheriff in a jail to die from COVID last week. So it's the deputies that run these jails in many of our areas have COVID, and they can't come to work. So what's happened is they may have COVID or they may be on quarantine. So our staffing is significantly reduced. And what does this mean? What does it mean when you have a jail that has a reduced staffing, and the population is still there that has to be dealt with? Well, what it has meant to several, especially larger jails, inmate movement has come to a halt or significantly reduced because there's no one there. The deputies are just having to keep the inmates, and they can't move them around. It has an effect on our volunteer programs. It has an effect on our GED programs. Visitation has been shut off, and weekend sentences have been eliminated in many areas because you have people coming and going, and the sheriffs are trying to keep COVID out. So therefore, you try to keep out people that are coming and going out of the jail. The light at the end of this long dark tunnel is that we now have deputy sheriffs in 1B that are beginning to be vaccinated, and that's wonderful. Next slide, please. The next area I want to touch on relating to COVID and the significant impact is mental health. We all know that the state hospitals have had COVID outbreaks, resulting in a reduction of beds of last resort. So what that means to the sheriff and really to the local police that do these TDOs, the TDOs are being issued, they're being served on the individual, and then the sheriffs are having to sit with these TDOs on marathon sessions. I mean, the TDO expires in 72 hours, but we are having to stay with the person. Sometimes it's turned into days, not hours. And when it turns into days, the shifts actually have to change. When the sheriff is responsible for watching someone on a TDO, and the deputy gets exhausted, and the person may actually be admitted to the hospital, but because they're responsible for security, they have to stay there. So we're sending deputies in and changing shifts on TDOs, and it's a tremendous hardship. It's a hardship, especially in areas where sheriffs have primary law enforcement in those 86 counties, and we have a high turnover, and I'm gonna get to that in just a second, but you have a high turnover, and then you have deputies assigned to a TDO, at a hospital for up to 72 hours. And I say sometimes more than that, because even though the TDO expires, the sheriffs are telling me, we can't just walk away and leave someone that may be dangerous in a hospital and expose everyone to whatever may happen. So sometimes they continue to hang around to deal with the dangerousness of the situation. The next slide, please. One of the key issues is the turnover. If you look at these numbers, they're higher than they've ever been. A C7 is a entry-level deputy sheriff. All the sevens. The C is a corrections officer, and we have a 35% turnover rate. We've never been that high, Mr. Chairman and members of the committee. And imagine running an operation in which 1/3 of your deputies are turning over. We are continually training and losing deputy sheriffs. The court services is a 21% turnover, and in law enforcement, we have a 27% turnover. Now, all of these are for the entry level, and when you factor in the higher paying deputy sheriff scales, we would call them an L8 or 8 or 9 or on up. If you factor that in, it's still an excessive turnover, way above the normal at 16.4%. Now, I've got the starting salary listed there from the compensation board. It's $33,475, and I want to say about that, that is the state starting salary. That's not the starting salary, because there are a lot of localities that give supplements, but there are some that don't. And then there's another group moving up. They give a very small supplement. We have, the last time I looked at the figures, we had a handful that gave absolutely no supplement. And then you had another group, a couple of dozen, and I don't have the figures in front of me, that gave 1 or 2%. So that's not a lot of help, but it's all the locality could do. The next slide, please. So I'll leave you with some recommendations and some thoughts and some takeaways. The salaries of these deputy sheriffs need to be increased. It's just low all over the state. It's contributing significantly to our issue. The overtime funding pursuant to the executive order would greatly assist the sheriffs relating to the TDOs and relating to the jail issue. Mental health beds, we have the beds of last resort, they're filling up. They're full. They're running at 98%. And when they get there, under the latest executive order, the hospital can tell the deputy that has the TDO already issued, we can't take the patient. That's not good for anyone. And it's especially not good for the patient. The person needs to get services. And so we just think there ought to be more beds. Another issue that we're looking at, and you may see later this session, is to expand the role of I'm getting the feedback.
Could everybody please mute their microphones?
The last one is important. The General Assembly gave provided, I think it was around $7 million to do alternative transportation providers on TDOs. And we're looking at actually trying to amend the contract. We may need Appropriations Act language change to do that, to expand their role to provide security services while these patients are in the hospital. So, Mr. Chairman and members of the committee, and Mr. Chairman, you asked me to talk mostly about COVID. So there are two takeaways. One is the issues relating to the TDO and the jail and the alternative transportation providers, the necessity to enhance their role, and backing up the overtime issue. You'll probably see a move made in the budget process to enhance overtime for sheriff's offices to be able to pay these people when we have to call deputies, really call them out of bed after they've already worked and go and fill in while a deputy is doing a TDO. We're required by law to do overtime, to pay overtime. And I don't think the state will pick it all up, but there may be some help there. I'll end there, Mr. Chairman, and try to answer any questions you or any members of the committee have.
Thank you, Mr. Chairman. I appreciate it. Delegate Bourne, you have a question?
I do. Particularly related to the turnover numbers, I wonder if Mr. Jones has any supporting data or backup data to break down those numbers. And by way of example, I mean, of the 20% of turnover that is happening in our court sector, how much of that turnover is retirement? How much of that turnover is disciplinary actions? How much of that turnover, what's behind those numbers? If he has any idea.
Mr. Chairman and Delegate Bourne, thank you. That's an excellent question. I think that most of the turnover, and let me just say, because of this significant increase, you may recall when I came to the committee back in the summer, these turnover figures were high, but they were not this high. So and we've done surveys, we've asked deputies, and I've had sheriffs call me when they're doing exit interviews, and the officers, the law enforcement, court services, and jailers, they're finding other work that pays more than $33,475. So I think you're just having people get into it, they look at it, and they can't feed their families. But I can try to find actual data on the reason for that. And if I need to, I can actually survey some of the sheriffs to see exactly what the exit was.
Yeah, I mean, that would be helpful for me, but don't do anything special just because for that reason. And I ask just because I'd really like to boil that number down to what's the actual percentage or number of sheriffs and sheriff deputies that are leaving for for money, right? And because that's one thing I guess we can address. And how many localities or sheriff's offices don't provide the local supplement or appropriation?
good question, Mr. Chairman and Delegate Bourne. I would say, and this is an estimate, but it is based on a survey that I did within the last year. There were, I think, 7 localities that did absolutely no supplement. Then there were another maybe 15 or 20 that did a very small supplement. So and then take it on up, and I had those figures, and I can provide that.
So really, the 33 and change is not really the entry level salary for the vast majority of deputies.
That I would say that's accurate, but it is the entry level for some, and it's a significant number. 5% or 10% on 33 is still not a lot. So I would like the opportunity to drill down into that and to provide you with more.
Yeah, I just want to see some real numbers, both on the turnover and the salary stuff. Thank you, Mr. Chairman.
Thank you. And I think to build on Delegate Bourne's point, I mean, I would like to understand what's the normal attrition rate versus what it is now. And I'd be interested to know what other careers are they pursuing? And are they actually going to another law enforcement agency where they can get paid more? I know that's the case with a lot of correctional officers. We just need to take a look at our law enforcement salaries in general and make sure that they're being paid fairly. Because I know that this is across the board. Virginia's not done a good job in treating law enforcement over the years. And so this is something we appropriations, I hope they're taking a look at. Other questions from the committee members?
Mr. Chair, may I?
Yes. Who is this? Who is this that raised their hand?
Me, Angela Graves.
Delegate Graves. Yes.
Delegate Graves. Yes. So the only thing I would like to do is add a comment in terms of my background is not just as a city council member, but I worked in the city before being elected. And part of that time I worked in the Norfolk Sheriff's Office. And so when issues would come up with our sheriffs and our sheriff's deputies, I did develop a close relationship with our sheriff, who is Joe Barron, now in the city of Norfolk. And I can tell you that from memory, a lot of the conversation that we had when it came to why deputies were leaving, it had to do with safety and pay. So there is a correlation of the job that they had to do and how safe they were to the amount of money that they were making. And when we would lose them to other law enforcement agencies. And I know specifically for Norfolk, I could get that information to the committee chair. And I'm certain that the presenter can get it, for the entire state. But a lot of the we didn't have as much attrition in terms of retiring as we did have individuals leaving for either higher paying salaries in another law enforcement area, or they left because they just found other employment that paid them more. We recently, just before I left council, had a conversation about the Hampton Roads Regional Jail and the safety concerns that are there, and not having the appropriate number of deputies and corrections officers in a facility presents a safety hazard for not only the deputies and corrections officers that are working there, but also for the inmates that are there and the civilian staff. And I think that's something else that people don't necessarily realize, is that there's civilian staff that's working there in those areas, like the GED or in the food service or in healthcare. They're the healthcare providers that are there. So it is really a big problem. And we're asking law enforcement officers to go out and do a dangerous job, and we're not compensating them to the levels that they should be compensated, because they are taking a risk every single day when they leave home that they may not come back to their families. And so a lot of it really boils down to safety and money and in the terms of compensation. So thank you, Mr. Chair.
Thank you very much. And we're trying to create a professional law enforcement agency, particularly with all the work that we've done in special session and the training that we have high expectations. And so we want the best and continue to have the best. So I appreciate your comments there. Delegate Levine, you're recognized.
Thank you, Mr. Chairman. I have a quick question for Mr. Jones. Mr. Jones, do you have, it's logical to me that folks that are not being paid very much are more likely to have attrition, but you gave us sort of a general figure for everyone across the Commonwealth. Do you have a breakdown to say in these localities where they're paying low, there's more attrition, in these localities where they're paying high, there's less attrition? Do you have that kind of regional breakdown?
Yes, sir. I have a spreadsheet that's very much detailed. I did not include it in this package, but I can certainly get it to you and all the members of the committee, Mr. Chairman and Delegate Levine. Thank you.
That demographic information sounds like something that we would like to see. Are there any other questions for Mr. Jones? All right, Mr. Jones, thank you for joining us. We appreciate it. This committee has
Hey, hey, Patrick, I don't know why I didn't show my hands up, but anyhow.
I didn't see your hand. Delegate Ferris, I recognize that voice, though.
All right. Hey, this is not necessarily a question, but I think it's a discussion we should have while Mr. Jones is on with us, because I know that I represent 5 counties, 5 different sheriff departments, and they won't be available to have their shots till next Tuesday in my health district for COVID. I think that's a discussion we need to have as a committee, is what we can do to move, or do we think we need to move these sheriff departments, which are the primary, not only the primary police departments, but they're the primary, some places only paid rescue or 911 services that deal with everybody until the fire departments or rescue squads get there. And I just would like to have that discussion as a group.
Yeah, I suppose that this is sort of all over the map. I spoke to my sheriff earlier in the week from Arlington, and they were getting their vaccinations this week. And I don't know if that's the case. Mr. Jones, do you know what the schedule is for the sheriff's deputies?
I have a sense, Mr. Chairman and Delegate Ferris, and thank you. That's a great question. The law enforcement community is in 1B. And, we've been working closely with the administration. There just simply were not enough vaccines originally to move into 1B. And we made strong arguments that we ought to be in 1A. And, I think way up the line, maybe not even in Virginia, the CDC said we ought to be in 1B. But if you look at where a jail is, you've got folks in that jail, they don't have a choice. If they go to work, they're in a jail just like in a nursing home. So now we're all moving into 1B, and it depends on supply. It's supply driven. And I just recently looked at the Department of Health has a website and talks about each locality, what phase they're in. And there are many of them moving into 1B. And some of the sheriff's deputies and sheriffs have already gotten the vaccine. Others, it'll be another week or 2, or maybe even longer. But I think a lot of it depends on supply.
Yeah, we got to get
Mr. Chairman.
Delegate Corey, you're recognized. I hear your voice.
Thank you, Mr. Chairman. I appreciate this conversation. I'd like to remind everyone that yesterday I asked that we would adjourn from full session, the floor session, in memory of Butch Campbell, a deputy sheriff in Fairfax County who has just died of COVID. That, to me, highlights very well the problem we're talking about. And I urge everyone in the committee to get in touch with your local health department and encourage them to allow the sheriffs and sheriff's deputies to be vaccinated as soon as possible. Thank you, Mr. Chair.
Thank you, Delegate Corey. Any other questions before we adjourn? I think we've had enough. We've had enough of Sheriff John Jones. So thank you so much for joining us, Mr. Jones. Appreciate it very much. Can we bring in Wayne Huggins from the Virginia State Police?
I'm here, Mr. Chairman. Can you hear me?
Yes, sir, we can. Welcome. Thank you for coming.
Well, thank you, Mr. Chairman, for inviting me. And just as a point of clarification, I am the executive director of the Virginia State Police Association. I am a retired superintendent of the state police and a retired sheriff. I was the sheriff of Fairfax County. In my current position, I represent the State Police Association and very much appreciate the opportunity, Mr. Chairman, that you've extended to us to share some remarks with you today. And I'd like to start with our experience with COVID so far. Like everyone else, it has not been good. On top of everything else that's been required of us, it's against the backdrop of COVID looming ever present. Since last March, we have had 205 of our people confirmed with COVID cases. We have had one fatality. That was a civilian who worked here at State Police Headquarters in Richmond. He died about a month ago. One of our communications experts, as a matter of fact, 30-year employee of the Department of State Police. We currently, as of today, have 62 active cases. We have had 849 potential exposures for which folks have been quarantined. So like everyone else, we've been laboring under this possibility of COVID. And of course, as you well know, not only do our day-to-day routine responsibilities bring us in contact with the public, but we've been called upon over the course of the last 6 to 8 months to be in these super spreader events. And for those of you that may be aware, I know everybody is aware of what happened at the Capitol last week. We had a couple of hundred troopers right there on the front line. In fact, Mr. Chairman, I shared a video with you and with some other members of this committee about our involvement there, and it was quite dramatic. So COVID continues to be a problem. Our troopers have begun getting their vaccinations. In fact, I talked to a trooper in Roanoke yesterday who received his vaccination yesterday morning, along with some other troopers in that area. I know there have been some in Southwest Virginia who have received their vaccinations. But I think the point you made, Mr. Chairman, it's kind of all over the map, driven by various health districts and the supply of vaccinations they have available. But in response to Delegate Corey, I would hope that when you reach out to your local health departments that you ask that the state troopers in your areas get that vaccine as soon as possible also. Now, all of this has been exacerbated behind the backdrop. As of this morning, we have 328 trooper vacancies around the state. And to put that into some context, the first week in December, we had 292 trooper vacancies. In November, we graduated a basic school of 39 people. And even with that, our vacancy rate grew by some 36 troopers over the course of the last month. In response to Delegate Bourne's question of Mr. Jones, of those 38 that we've lost since the beginning of about the first week in December, the majority of those have been through retirement. We did have one trooper who left to join a local fire department. He said he'd had enough of the law enforcement profession. And quite frankly, our people, the second they become eligible to retire, are leaving. That doesn't mean they're going home and sitting in a rocking chair. What that means is they're seeking other employment outside of the law enforcement profession. In addition to the 328 trooper vacancies we have today, we have about 138 civilian vacancies. In response to this, a number of you, about 50 members of the House and the Senate, have visited State Police Headquarters over the course of the last couple of months and received an informational briefing that's lasted anywhere from 2 to 4 hours on our training program and exactly what we're doing to try to address some of these recruitment and retention issues. This is not a good environment for law enforcement to be recruiting people in, particularly when we're basically competing with one another for the same pool of applicants, and whoever can offer the most amount of money is generally the ones that are getting that qualified pool of applicants. I know right here in the Richmond area, Chesterfield and Henrico have both just taken recent actions to increase their compensation, and it puts them ahead of us. We are sorely lacking in our entry pay, which is about $44,000 a year. We want to attract the highest quality men and women into our profession and into the Virginia State Police. We've had conversations with your own Delegate Don Scott, who has introduced House Bill 2260, which is a bold plan to try to help the Virginia State Police with our pay compression problems, our salary inequity problems, and to make us competitive, to diversify our department, to be able to attract college-level graduates, and our new pay plan that has been developed and been proposed that some of you have seen. It has an educational component to it. Many of you had asked us to consider putting in an educational incentive program for not only four-year degrees for applicants, but also to incentivize current state police people who are not college graduates to go back and to continue their education. And that plan has been developed, and Delegate Scott has seen it. I won't speak for him, but I think he's supportive of it, as evidenced by the fact he has introduced this legislation. Companion legislation has been introduced by Senator Edwards on the Senate side, along with corresponding budget amendments. So that, in a nutshell, is kind of where we are, the struggles we're facing. Needless to say, this last year, I became a trooper 50 years ago, 1971. I started my career with the state police. Quite candidly, I would be less than candid if I told you I've never seen morale lower. I've never seen the challenges greater. I've never seen us being asked to do more. I don't think any of us would have ever thought we'd see Virginia State troopers standing on the front line in the United States Capitol, protecting it from the violence that we saw last week. But nonetheless, we were there. And those videos demonstrate just what our troopers were confronted with, the abuse they took, the assaults. We've had any number of troopers injured over the last several months in these the protests, riots, whatever you choose to call them, a lot of equipment damaged. So it's been an extremely, extremely challenging year for the state police. We need your help. It's just as simple as that. And we're trying to do what you're asking us to do each and every day. So again, Mr. Chairman, thank you very, very much for this opportunity to share these comments with you. And I'm certainly available for any questions that you may.
Thank you so much, Mr. Huggins. How many Virginia State troopers responded to the Capitol last week? Do you know?
About 200.
200. And
Yes,
and do you know, I know there's a number of National Guard that is stationed, and I know all this because it's in my backyard. How many of National Guard? How many do we have? Any troopers down there lined up outside the complex of the Capitol, or is that all
Right.
National?
I don't know of any troopers who are there now. I know we're planning for whatever may come our way here in Richmond next week. But I don't know. We may have. I'm just not aware of any being there today.
I know there's Virginia National Guard. I just didn't know whether they were Virginia State Police or not. Any questions for Mr. Huggins? Delegate Price, you recognized.
Yes, thank you, Mr. Chairman. Hello, Mr. Hudgens. So I appreciate the situation that they were put in on Wednesday, and thank anyone that was there to protect democracy. On the flip side of that coin, we did see national news where there were some Virginia police officers off duty that were on the other side of that event. And I wanted to know, what are you all doing within law enforcement to do your due diligence to weed out any of the folks that were on the other side and part of the insurrection on Wednesday, so that they are no longer a part of Virginia law enforcement?
Mr. Chairman, Delegate Price, thank you for that question. The Virginia State Police has always taken our ethical responsibilities extremely seriously, going back 50 years when I became a trooper, through my tenure as superintendent, and up to today. And while I can't speak for the department, I am no longer with the department, I can tell you that that standard of professionalism, the expectations are there today, as vibrant as they've ever been. I'm not aware of any Virginia State troopers who were on the other side of our line. But again, there were thousands upon thousands of people there, and I don't know the identity of all those people. What I would suggest is that you might want to continue this conversation with Colonel Settle and his executive staff at the department.
Yeah, that's a great idea. Delegate Price, did you have another question? Okay. And any other questions for Mr. Huggins? Great. Thank you so much, Mr. Huggins. Thank you for being here. Really appreciate your perspective, and thank you for being here. That completes our agenda.